Characteristics of our patients and characteristic of chemotherapy. 10 patients have had non-Hodgkin's lymphoma, 9 patients had Hodgkin's lymphoma, 7 patients had metastatic breast cancer, 3 patients had metastatic skin melanoma, and 1 patient had metastatic testicle cancer. These are regimens of chemotherapy. The standard regimens of cytostatic chemotherapy were prescribed corresponding to diagnosis of the tumor. It is well known that these regimens of chemotherapy are very aggressive and they frequently cause leukopenia as the main toxic side effect of these regimens. It was found that CGNC has strong leukoprotective effect, corresponding to an estimation of leukopenia degree proposed by World Health Organization. After the first course of chemotherapy, all patients had leukopenia of the first, second, or third degrees. However, after the second course of chemotherapy with simultaneous application of CGNC, normal level of peripheral blood leukocytes was in 40% of patients, and the difference between CGNC group and control group was statistically significant. It's another estimation of this therapeutic activity. In comparison with an initial level after the first course of chemotherapy without CGNC, decrease of leukocytes in peripheral blood was 57%, whereas after the second course of chemotherapy with CGNC, this parameter was only 28%, and the difference between the two groups was statistically significant. More expressed effects of CGNC on hematopoiesis have been revealed as the analysis of its influence on a level separately of granulocytes in peripheral blood. In comparison with initial level after the first course of chemotherapy without CGNC, decrease of granulocytes in peripheral blood was 70% and only 25% in group with CGNC, and this difference was also statistically significant. Thus, CGNC protects myelopoiesis in cancer patients with systemic or metastatic malignant tumors who are being treated with cytostatic chemotherapy. CGNC significantly reduces degree of leukopenia and prevents loss of leukocytes and granulocytes in peripheral blood. And last section of my presentation, briefly other medical application of CGNC. Acute respiratory viral infections. CGNC reduces the rate of acute respiratory viral infections in children and teenagers and rescue workers at the Chernobyl nuclear power station accident and in pregnant women. Tuberculosis. CGNC normalized parameters of hematopoiesis and immunity and also reduced sensitivity to tuberculosis mycobacteria in practically healthy women who are nurses in tuberculosis hospital and were in frequent contact with infected patients. Viral hepatitis. Addition of CGNC to standard therapy by interferons was shown to lead to faster recovery of liver function, reduction in anemia symptoms, and reduction in the severity of side effects of interferon therapy in patients with chronic viral hepatitis. It's all antimicrobial activity of CGNC, wide antimicrobial activity of CGNC. Intestinal dysbacteriosis. CGNC facilitated restoration of beneficial bifidobacterium and lactobacillus levels and normalized function of gastrointestinal tract in patients with disorders of human intestinal microflora. Cardiovascular disease. CGNC was shown to reduce the level of total cholesterol, LDL cholesterol, and triglycerides in patients with coronary heart disease and hypertension who had hyperlipidemia and dyslipidemia. Gastrointestinal disease in children with gastrointestinal disorders. CGNC helps to eliminate heavy metals from the body, in particular lead and chromium. Lung disease, occupational lung disease. CGNC treatment improved pulmonary gas exchange and other pathological parameters in these patients. Oral disease. In Sankt Petersburg, a clinical trial was conducted with a toothpaste based on CGNC in patients with periodontal disorders. It has been shown that long-term prophylactic use of the toothpaste to maintain good oral hygiene, reduce gum bleeding, and also had deodorizing and whitening effects without any toxic or harmful side effects. The overall summary and conclusions. CGNC is natural substance that contains a range of biologically active compounds such as chlorophyll, carotenoids, vitamin E, and phytosterols and others. And these compounds have wide spectrum of therapeutic and preventive effects such as anti-carcinogenic, antioxidant, anti-atherogenic, immunostimulating, hemopoietic, and other antimicrobial also and other effects. CGNC significantly inhibits carcinogenesis of the various organs in models of carcinogenesis in animals. CGNC has strong therapeutic effect in patients with high risk of stomach cancer suffering from atrophic gastritis, and decreases the rate of regression of precancerous conditions such, for example, as intestinal metaplasia. And in my opinion, the use of CGNC appears to be a promising approach to prevent gastric cancer. It is a secondary cancer prevention of the stomach cancer. It is very interesting that CGNC suppresses Helicobacter pylori, very popular bacterium now in the world, in patients with atrophic gastritis. And in my opinion, it may be useful in eradicating Helicobacter pylori in treating related disorders such as common gastritis, ulcer of stomach, and duodenum. I think that CGNC the use of CGNC is very promising for prevention of reinfection Helicobacter pylori after the standard course of eradication by antibiotics. Experimental and clinical studies have shown that CGNC does not have significant toxic or other side effects. In my opinion, CGNC appears to be an ideal natural medicine for use in cancer chemoprevention because it meets all requirements for an effective cancer chemoprevention drug. In my opinion, further clinical studies of CGNC for cancer chemoprevention related to the main cancer of human are proposed. CGNC also protects myelopoiesis, leukopoiesis in cancer patients being treated by cytostatic chemotherapy. And CGNC could be prescribed as an adjuvant that protects myelopoiesis during anti-cancer chemotherapy. In addition to oncology, CGNC can be used in other fields of medicine because this compound has a very wide spectrum of other health benefits. Thank you very much for your attention.